Hi, I'm a therapist and a postdoctoral fellow in clinical psychology at Stanford University, and today I'll be talking about 15 different cognitive behavioral therapy tools, or CBT skills, that you can use to improve your mental health. These skills are evidence based, so they're supported by science, and they're the ones I use with my patients in the therapy room, so hopefully you find it useful as well. So the first skill that I'll talk about is the cost benefit analysis. And the reason why I'm starting here is because oftentimes when we think about making a change or incorporating something into our lives, there's both upsides and downsides. Like if you want to work on your social anxiety, you want to be more confident in front of people, then you're going to have to do things like, speak in front of other people, have uncomfortable, awkward conversation. So it's important to use this sort of cost benefit analysis, otherwise known as pros and cons, to identify whether this change actually feels right for you. And at its most simplest form, you can kind of have the pros of making the change on one side and the cons of making the change on the other side. And then afterwards, based off your values and your goals, decide whether it makes sense to change or to stay the same. So a second important skill in CBT is something called thought monitoring, where essentially you're writing down the thoughts or worries in response to different stressful situations. Maybe you're at a party and you're talking with someone, and all of a sudden you have the thought, I'm really boring. Or you just got a C minus on your presentation and you're thinking, I'm a terrible student. And the reason why this is helpful to jot down is because it then allows us to gain awareness as to what type of thoughts pervade our mind and what are the thoughts that really influence our mood and our emotions. Now that we've gained awareness of our thoughts through the thought monitoring, now it's important to be able to actually do something with them. And one strategy that can be really helpful is something called evaluating the evidence, otherwise known as check the facts. And this is helpful because it allows us to actually check the facts or the validity of the thought itself. Like, I'm a terrible student. Is it actually true based off the grounded reality, based off what I know about myself and the things that I've accomplished? So maybe in the context of I'm a bad student, maybe there's some evidence that suggests that you are not necessarily a totally bad student. Maybe you've been doing really well in certain subjects, or you're participating in extracurriculars, or you're overall just a very participative student in your classes. All of those things then provide competing evidence against the initial automatic thought. So alongside checking the facts, a fourth strategy is actually asking the question, is the thought helpful? And the reason why this is important is because sometimes thoughts can be valid and true, like maybe you haven't been doing so well in your classes and you're kind of not such a great student, but the thought itself may not be particularly helpful, like especially if the thought, I'm a terrible student, makes you feel ashamed, makes you withdraw, makes you decide, this is not worth it, and then you quit out of school and then you kind of fail out of life. Then in this case, that specific thought isn't particularly helpful. So we can kind of say, actually, this thought is not so helpful and thoughts are not facts. I don't actually have to engage with it all that much. So I'm just gonna let it go because it's not useful. And oftentimes, along with these sort of negative thoughts, we also make negative predictions about our day-to-day life. Like, for example, if I were to try something new, I'm not gonna like it. If I were to interact with somebody, they're not gonna wanna talk to me. If I were to ask that person out, they're gonna say no. So we're constantly making predictions about our day-to-day life. And the most important part is that we kind of believe it and our behaviors dictate that. Like, for example, we won't try that new thing out. We won't ask that person out because we believe that our prediction was true. So one strategy that can be super helpful, a fifth strategy, is called behavioral experiments, where we basically say, actually, I just made this prediction in my head, but I have no idea what is actually going to happen. So why don't I test it out? So you give out the experiment a little bit of a try. You ask that person out, you try out that new bubble tea flavor, or you try out that new restaurant, and you just see what happens. And the great thing about the behavioral experiment is that it allows us to understand that our predictions are either not always true, or even if it is true, we are resilient enough to survive it. So it's okay either way. So one of the emotions that a lot of my patients deal with is a strong sense of guilt and blame towards everything that happens in their lives. Like, especially if it's the negative stuff, they kind of feel like it was all their fault. They kind of personalize it. Like, for example, if there was a group project, if they didn't do super well, it would be all their fault that they didn't do so well on that project. So a sixth CBT strategy is something called a responsibility pie or responsibility chart, where essentially you're breaking down who or what was responsible for the overall outcome and what was the proportion of their responsibility. So for example, let's say, Roy didn't even attend the presentation, so he was like 20% at fault for the poor score. And Jamie didn't really do her part, so you kind of had to take over. So that was a little bit of responsibility over there. And maybe you were just feeling sick during that time and that kind of impacted your overall performance. And ultimately, the responsibility pie isn't supposed to like shift blame to everybody else so you don't have to take any responsibility for yourself. It's really just to reduce a sense of shame and and guilt so that you're able to then reduce these emotions to be able to then operate more effectively in your day to day. So, a seventh CBT skill is something called mindfulness. And mindfulness, at its very core, is a practice that allows us to cultivate a sense of non judgmental awareness of our day to day. And the reason why mindfulness can be so helpful is that it allows us to get out of our automatic pilot, where we're essentially kind of just reacting and we're kind of just following whatever our inclinations are in that very moment, to being much more aware and present focused and intentional as to what we're trying to do given our goals. And the other piece about mindfulness that's so helpful is the non judgmental aspect of it, where oftentimes we put lots of value judgment and salience to our experience. Like an emotion is terrible and we really hate that emotion, so we run away from it. Or certain thoughts like I'm worthless or I'm a bad person, those things really grip us and then we feel really stuck in those moments. But mindfulness allows us to give us space, give us distance from these experiences to then be able to say, actually, these thoughts and our emotions don't have to have so much power over me. I can kind of be over here and these thoughts and emotions are over here. And I can kind of almost like feel this wave of like relief knowing that I am not my emotion and I am not my thought. Okay, so now that we've talked a little bit more about these cognitively focused skills, let's move into some of the more behavioral skills. An eighth strategy in CBT is something called activity scheduling. And as the name suggests, really in activity scheduling, you're putting activities into your day that you know are going to nourish you and give you a sense of those more positive emotions. And this is particularly important in the context of depression, where we often feel amotivated, we often feel really crappy and down and depressed. And as a result, we stop doing so many of the things that we typically enjoyed in the past. So in the context of activity scheduling, we're saying, hey, what are some of these small activities that I can engage in that would allow me to cultivate a sense of pleasure, competency, social connectedness? What would allow me to break out of this depression trap and get me back on track in a meaningful, sustainable way? So a ninth CBT skill, which you may already be familiar with, is the exposure practice, where we're essentially sitting with something that causes us some fear or some distress. Like if we have a phobia of dogs, then spending some time with dogs will help us reduce our anxiety surrounding that dog. Or, if we're fearful of like presenting in front of other people, then being able to do these presentations and talk in front of the camera, for example, will help reduce my own anxiety towards that actual practice. And the reason why exposures can be so helpful is that because our initial intuitive reaction to something we fear is to avoid it. And avoidance is great for short-term relief of anxiety, but it maintains the problem in the long term. So exposures basically allow us to sit with something and be able to learn, actually, this is not as scary as I thought. My brain realizes that there's nothing threatening or life dangerous happening. And as a result, we develop a sense of self-efficacy and our anxiety towards a thing reduces. Sometimes people have the criticism about therapy that it's all about just talking about problems and nothing ever really gets done. But that's actually not really true in CBT therapy, where in the context of CBT, one of the main strategies, number 10, is actually problem solving. So for the things that are more productive worries, the things that you actually have to resolve in your life, we actually work together to figure out how do we resolve that problem in your life. For example, let's say you have to make an appointment, but you need childcare before that happens, then that's going to be a problem that requires solving. So in this case, problem solving would take an approach of, okay, let's actually identify what the problem is, what the solution is, what are the possible alternatives or possible solutions I can choose from, and then I pick the best one from the batch. Like for example, maybe in this case about needing to have childcare before I go to my appointment, maybe I'm going to call up my mom-in-law or dad-in-law whether they can take care of my kid before I go to the appointment. So that will work for me, that resolves my problem, and if it didn't work, I can pick something next down the list. CBT skill number 11 are relaxation techniques, which can be basically anything. There are a number of different relaxation exercises. You could probably go on YouTube right now and find 500 different relaxation tapes, but the idea behind relaxation is to reduce our general fight or flight response or physiological arousal. And you can do that, for example, with deep breathing, where you might breathe in for 4 counts, hold for a couple counts, and then let go for 6 counts, and then repeat that a few times until you get to the point where your overall physiological arousal reduces and you're feeling a little bit calmer. Number 12 are coping cards. So what essentially coping cards are I think of them as like little therapy extenders, where sometimes we might talk about things like I talk with my patients about ideas and they're like, oh my gosh, that's such a great idea. But then they might kind of forget it because they have busy lives and they have lots of responsibilities. So a coping card basically says, okay, what is the thing I can write on my little paper right now that I can bring with me throughout the day, that if I need something to distress myself, or I need to remember that lesson I talked about, or that principle or that idea or skill that would be super useful when I'm super distressed, where can I bring it with me and put it somewhere so that I can see it, so that when that happens, I can remind myself what to do. And the 13th CBT skill is something called SMART goal setting, where SMART goals stand for specific, measurable, achievable, relevant, and time bound. Where sometimes when we set goals, they're kind of like nebulous and vague, and it's hard to really know when we achieve them. Like, for example, if we think about being more fit or being more social, at what point do we know that we've achieved this goal of being more fit or being more social? So, SMART goals basically says, let's make this a little bit more specific and a little bit more achievable given where you are at. So, for example, the goal of 15 minutes jog for 3 times a week, that's a pretty smart goal because it's specific. I'm going to jog for 15 minutes. It's measurable, so I can kind of feel and check how I feel before and after the jog. It's achievable, in theory anyway. So, for example, if you haven't ran in a long time, maybe 15 minutes a few times a week is a pretty good benchmark. It's relevant because it's relevant to my goal of being fit, and it's time bound. So, at the end of the week, I know whether or not I've met the goal or not. All right, last two. CBT skill number 14 is called worry journaling, where you essentially take some time in the evening, maybe 7 or 8 p.m., and for the next 10-15 minutes, you give yourself permission to worry, where essentially you can write down all the worries that you think might bother you down the road, at night, for the next day, whatever that might be for you. Write down anything that comes to mind, and these are either productive worries or hypothetical worries. Productive worries, you can kind of problem solve and write down what is the solution to this particular worry, and if it's more of a hypothetical worry, like you're worried about potentially getting sick down the road and not being able to provide for your family, in that case, you can just write down your thoughts and feelings associated with that worry. Allow yourself stream of consciousness to just flow and write whatever you think you want to write on your page. And oftentimes we find that really helpful for processing and sitting with the emotions that we've been dealing with. And a lot of my patients actually report feeling a little bit more relaxed and light afterwards. And number 15, the last CBT skill that I'll talk about is something that is called a self-compassion practice through the best friend exercise, where essentially we're often our own worst critics and our own worst enemies when it comes to being super hard on ourselves. At the same time, we tend to be able to extend a lot of compassion towards other people. And the idea behind the best friend technique essentially is to say, if someone else, a best friend or a mom, dad, or whoever it might be, is in the same situation as me right now, what would I say to them? And oftentimes, when you take that approach, you're able to come up with very compassionate responses to another person's situation through this sort of common humanity that you normally wouldn't have been able to extend to yourself. And then once you've given all those wonderful things to say to that person, you can kind of say, okay, is it okay for me to give it to myself? And if it's hard for you to give yourself that self-compassion in that moment, remember that the goal of self-compassion isn't necessarily to treat yourself like a baby and then not take any responsibility. It's really to just reduce the distress enough for you to then feel a little bit better to operate effectively towards your goals. And if the question of do I deserve it comes up, you can change the question. Ask yourself instead, is it helpful for me? Would it be helpful for me to give myself some self-compassion, a little bit of reprieve, so then that allows me to act upon my day a little bit better? And there it is, 15 different CBT skills that you can now apply into your life in however way that you want. And of course, I encourage you to just pick one or two to start with. Like, all of these skills are kind of like muscles. You kind of have to train them to get really good at them. And I don't want you to feel overwhelmed with having all these different skills. Even I don't necessarily give my patients all of these skills. Like, I kind of pick a couple that I think would be most useful for them. So I encourage you to do the same and be your own therapist. Pick a couple that feels right for you. Anyway, I hope you enjoyed this video and that you got something out of it. Thanks for watching as always. Bye-bye.